As 2020 wraps up, we continue to see the pandemic raging across the country, cases, hospitalizations, and deaths all at troubling levels. This as vaccine rollout slowly but surely getting underway here in the U.S. And joining us now to talk more about the state of the pandemic in the healthcare system, we're joined by Dr. Thomas McGinn. He is the Vice President of Physician Enterprise over at CommonSpirit. Dr. McGinn, thanks so much for joining the program today. I'd like to just begin with your assessment of the state of the pandemic within the healthcare system. If we go back to the spring, flattening the curve was about alleviating stresses on the system. As we stand here today, where are those stresses still?
Well, we still have a lot of stress, different regions at different places. Right now, particularly in Southern California and Phoenix, particularly in our health system, we're under tremendous amount of stress. It's the highest numbers we've seen. Across our system, we're at about 3,100 cases, which is higher than we saw back in the spring. I think here in New York, you're seeing an uptick, not quite as bad as you did have at the beginning of the pandemic, but it's inching up every day.
And go ahead, Myles. Sorry.
And as we, yeah, sorry, Dr. McGinn, as we continue to see those numbers rise, of course, the vaccine is here in some amount. How much are you working on the rollout plan when it does arrive in a more kind of mass audience type way? Or is it still, we need to get through this wave before you can begin, kind of thinking about vaccinating anyone other than, your frontline workers and your absolute most vulnerable patients?
Well, I mean, it is an interesting place that we're in right now. I always say we're in this, light at the end of the tunnel mode where we can see the light with the vaccine, but we're in a long tunnel. And the vaccine right now is strictly going out to healthcare workers, as you pointed out. And I think we're not going to be hitting, our patients out in the community probably until the late spring, because we still have a long way to go with our healthcare workers. And then once we get through that process, we're going to start giving it out to average citizens.
And Dr. McGinn, CommonSpirit is the largest nonprofit health system, I believe, in the country. You're talking about 137 hospitals, and you would oversee the physicians there, if I understand your role correctly. We've heard a lot about shortages during this pandemic, and so I just wanted to know, especially when you have such a large system at your disposal, what you're seeing in terms of shortages, in terms of staffing, in terms of morale as well among your workers.
Well, I think everybody's heard a lot about staffing issues, and we're holding our own. I mean, I think, as I mentioned, in Southern California, we have, unprecedented numbers of cases, and we're managing those cases. We have enough staffing. I think what we're all worried about is what you just said on that second point, which is staffing morale. Many of these folks are going through, it's almost like your third deployment, right? Going out and they're really getting tired. And when we talk to them, our biggest concern right now is keeping them upbeat, keeping them, fed and, supported in any way we can. But I do fear with the holidays, we're going to have another surge, and it's both that staffing, but that morale. I think that to me is number 1, 2, and 3 issue for us.
Doctor, CommonSpirit does a fair amount of work with lower income households in those living in underserved communities. How are you going to roll out a plan? How are you going to get them to take the vaccine? Take us through some of the steps you're doing to ensure that when the vaccine is available to this group, they in fact go out and get it.
Well, there's a lot we're doing in our educational campaigns. We're having actually many of we have several hundred clinics scattered throughout all the different communities. So we are engaging our communities locally, working with all our leadership in those communities, and using a lot of vaccine campaigns, demonstrate, as you've seen in the media with movie stars and things to that effect, showing all our healthcare providers getting their own vaccines. And I think one thing that people don't understand is about, a large percentage, I don't know it was probably 30% of patients who are hesitant or can be pushed over that finish line just in a conversation with a doctor or a nurse. So we're making sure that they have availability to talk to the doctors, to the nurses in all of their communities to have that conversation and get them over that hump.
Doctor, in your prior role at Northwell, you helped start a program where people who were even more acute cases of COVID were getting care at home. And so I'm wondering, now that you're in this role, what are some of the other creative solutions that you all are trying to come up with to deal with this pandemic, whether it is what we were just discussing, getting the vaccine out there, or also treating patients?
It's a great point. Most patients never walk into a hospital, and I think this is something that the media tends to miss out on. It's probably 80% of all COVID patients are treated, diagnosed at home. And then you have to look at all the patients that are getting discharged and they're going home. So like the program that you mentioned, we're also building this at CommonSpirit, and it's a multidisciplinary team of nurses. We have to have oxygen. We have to have blood work done at home. All of these things can be done virtually. So all these programs have been ramped up rapidly across our health system. So it's really a multidisciplinary. I wouldn't call it a hospital at home, but I would call it sort of a mini hospital at home. And we can, one patient that's not feeling well goes to the emergency room, might get admitted. That same patient, if given the right resources and support, can be cared for at home. They do better. And we keep them out of a crowded hospital. And that's something we're really working on in CommonSpirit. There's a lot more we can do in that space.
Well, and Doctor, that gets to I think it gets to my next question, which is, what is the future of healthcare like after the pandemic? I mean, as a concerned citizen, I remember sitting in my apartment in March being like, and at the time I actually had COVID. I didn't know it, but I did. And so I was like, well, I can't go to the hospital because I can't get in. And it seems like this thing is overstressed. And it just didn't make me feel very good about where this whole thing was at. So how are you thinking, if at all, right now? Obviously, we're still in the middle of it, about what the next decade or two looks like for healthcare? I mean, is at-home care something that you think and hope will be more applicable when COVID is indeed contained?
Well, you look great. So congratulations on getting through your COVID very well. So that's good to know. And actually, the vast majority of people do well. And that's the other thing people need to be aware of. So I think this has done tremendous things on innovation for care at home and virtual care. And we were all going through this process as we had, we talk about a surge. We surged in our virtual care, our ability to care for people at home. We went from just kind of starting that process to now really going way high in the volume of patients that we see at home. So I think it is something that we are strategically working on now. And a lot of this has to do with bringing more convenient care to our patients. And we can do that through virtual care. We can do that through other mechanisms that we're all forced to deal with in a way that was unprecedented in the history of healthcare. So I think all of us are sitting back and trying to think, what is that new normal going to look like? What percent of care will now be completely virtual? What does that do to the waiting room? What does that do to the examining room? Is it that 30% of care is going to go virtual? Is it going to be in primary care? Is it going to be specialty care? Where is that going to happen? The good news for patients is that it's going to be better for patients because it's going to be easier access and more patient-oriented, which is what we're driving in CommonSpirit. We had unprecedented amount of virtual care, and our patients are so happy with this. So it's really, what is that new normal going to look like is something we're all strategically planning for.
All right, Dr. Thomas McGinn, Vice President with CommonSpirit. Dr. McGinn, thanks so much for joining the program today, and have a great new year.
Thanks. Have a happy new year.